Our folks on the front lines paying the price. These waves of high numbers are hurting our frontline workers' mental health. WMER2 News' Mark Roper spoke with a nurse at Northwest Hospital in Randallstown. She says that healthcare workers are some of the most resilient people, but adds they're physically, emotionally, and mentally exhausted.
After dealing with the coronavirus for 9 months, doctors and nurses already stretched thin brace themselves for what a second wave of COVID-19 will bring.
You know, at the height of this pandemic, we were essentially in survival mode, going to work every day with this new virus, being fearful that we're going to take this home to our families. Not really knowing enough about it to know, like, are we really protected with what we're doing?
But now, an ICU nurse at Northwest Hospital admits the ongoing pandemic doesn't just have frontline workers concerned about their physical health, there's also a concern for the state of their mental health.
The patients are sicker than our traditional, regular ICU patients that kind of come in, which in itself is kind of taken a toll because we are exhausting all medical intervention possible. And, as a nurse, putting your heart and soul into taking care of and trying to save a patient, and we fail.
And COVID safety protocols leave patients to die alone without anyone by their side except for a nurse.
I'm going into a room to hold a hand or to hold an iPad and let a family say goodbye. And that probably has been the toughest part for me. As an ICU nurse, I'm used to that. I'm used to caring for patients and families at end of life, but not to this capacity that we're seeing with the virus, not these numbers of patients, and also not being the only contact that they're getting.
A recent survey by the nonprofit organization Mental Health America found the pandemic is taking a toll on the mental health of doctors and nurses.
The vast majority of them, are experiencing conditions like, stress and anxiety, but more than half are questioning whether or not they're in the wrong profession at this point. And, and 3/4 are concerned about their kids and whether or not they're going to physically negatively affect their kids, or even emotionally, whether or not they're giving the support to their children and families that they need.
Mental Health America President and CEO Paul Gianfrido worries about the long-term effects the pandemic will have on frontline workers.
Some people will develop PTSD. Others will develop psychosis. Others will develop depression. I mean, the whole range of mental health conditions will emerge out of this pandemic among people who were healthy going into it and who would have remained healthy if they were not put under the stress and pressure that they've experienced in trying to provide care to others during the pandemic.
Considering the increasing level of stress from dealing with life and death on a day-to-day basis, what keeps this ICU nurse going to work every day instead of calling out or just calling it quits?
I took an oath as a nurse, and I think that that's instilled in a lot of us. We have that responsibility to the community and to our families.
Such dedication. That was Mark Roper reporting. That is only part of that nurse's story. On WMER2 News at 11 o'clock tonight, we're going to look at how she and her fellow nurses and doctors are coping with these tense and emotional moments.